Hi, good morning. It's Dr. Larry Bush again, president of the Palm Beach County Medical Society, and as you know, an infectious disease specialist physician. So I thought we'd give a little more information today. There's some questions that are out there that maybe we can answer that everybody could see at once. First of all, what's going on with the pandemic? Everybody knows the worldwide numbers, but let me just give you an update on the national numbers as of 7:30 this morning, March 25th, 2020. There are 55,006 U.S. diagnosed cases, 806 deaths. That's a 1.4% mortality, most of which would be expected in elderly infirm people, the same group of people who unfortunately do badly with any respiratory infection that hospitalizes them. The leading states are not surprising. Almost two-thirds or three-quarters of the entire caseload in this country is made up between New York, New Jersey, California, Washington, Michigan, Illinois, Florida, and Louisiana. Why New York, New Jersey, California, Washington, and Florida? Those are main entry points for people coming into this country from Europe and from the Asian part of the world. And as we know, that this was an imported infection. This was an imported virus that was novel to the United States as well as the rest of the world. So if those are the entry points, and if the original large amount of cases were imported, then the local transmission would have to be higher in those areas. So those are why those areas. Let's bring it down to Florida. As of this morning in Florida, 1,467 diagnosed cases, 23 unfortunately have died. Again, most of them elderly infirm, a 1.5% mortality in keeping with the national average. Bringing it down to areas in Florida, the majority is occurring in Broward, Dade, and to a much lesser extent, Palm Beach County. Why would that be? Because most people who come into Florida from Europe or outside the world are coming in through the ports, airports, and boat ports in Broward and in Dade County. Now that's all closed off for some time now, so new cases would have to be local transmission. In Palm Beach County, as of this morning, 104 diagnosed cases, 3 mortalities, as would be expected. All 3, as far as I know, were people who were elderly, and I don't know what their comorbidities may or may not have been. But I think the most important curve that I look at from the CDC and the World Health Organization is that the amount of cases diagnosed spiked, which would be expected as testing ramped up. But the amount of new cases over the past few days, that curve seems to be leveling a bit, and the mortality is staying flat all across the board. So I think that whether we have rapid testing or how quickly we have testing obviously gives us more epidemiologic data. But if we do the recommended things, which is to social distance, people who've been exposed to a known case or a potential case, self-quarantine for 14 days, if we do all those things, those who are infected will get better, hopefully. Those who require hospitalization will be hospitalized, the majority of which hopefully are going to recover. But there'll be a decrease rapidly of spread because they'll be quarantined and people who are not quarantined will self-distance and therefore not be exposed. I have a lot of faith in our agencies, our local, our state, and our CDC. I know others are cynical. I have no reason to be. I know some of these people personally. I know their integrity. I know their knowledge. I know they have no reason to give me and you false information, not just in a personal level, but on an academic level. The bottom line is that we will overcome this because we have no choice and because I have confidence in us. I want to mention one last thing about treatment. There's a lot of information coming out about compassionate use medications and why not give a medication such as hydroxychloroquine, known as Plaquenil, which may or may not have some benefit. The answer is because the benefit that we're being told is anecdotal, which is fine. And a lot of observational studies are not randomized controlled studies. They're not anecdotal, but they're people who you've observed over time. And that's probably what's going to come from this is we'll have observational data and hopefully we'll have randomized controlled data. We as a society, I feel, cannot make medical treatment recommendations. I would use the resources that we've been putting out for each physician or healthcare provider to look at and review and make their own patient-to-patient decision. But I would refer you to one thing this morning, which was a JAMA editorial from a Dr. Khalil, who's at the University of Nebraska, and he's an infectious disease specialist. The editorial is treating COVID-19 off-label drug use, compassionate use, and randomized clinical trials during pandemics. And the plea that he was making is that yes, it's an individual basis, but going through this pandemic, and there'll be future pandemics and there'll be future coronaviruses, we will never have direct information as to what's effective and what's not as far as treatment or prophylaxis outside of randomized trials. That's not to say the society is recommending for or against, for example, using hydroxychloroquine or azithromycin. It's to say that we are not in the position to make that recommendation, but we are in a position to refer you to what we think are well-educated resources, and for you as a clinician to make the recommendation for your patient that you think is best suited. So I hope that explains some things. I'm optimistic because I don't see any benefit in being pessimistic. I always look at it like, what benefit would it do to be negative? I don't want to know what the problem is. I know the problem. What I'm asking all of us is, what's the solution? And I have confidence the solution is us doing the right thing right now. Thank you.